It is important to obtain a watertight closure of the deep capsule of the knee to prevent drainage. We prefer to use a running barbed suture. The deep tissue and subcutaneous layer of the skin are closed with an interrupted suture, and the subcuticular layer with a running 3/0 monocryl stitch to minimize the amount of tension on the skin. It is important to carefully remove the iodine-impregnated drapes to avoid skin irritation. It is also important to thoroughly clean and dry the peri-wound skin area, as some patients may be hypersensitive if any adhesive is left on the skin. We use a skin glue to seal the wound and help minimize drainage. It is important to allow sufficient time for the glue to dry so as not to stick to the dressing pad. If you choose to use steri-strips, cut the strips to fit the inside of the hydrofiber pad. If you use a zipline closure, there is a dressing shield called a Zipline DS, which prevents the zipline from sticking to the adhesive border of the dressing. The dressing is then opened sterilely and applied sterilely in the operating room. It is important that the dressing is applied with the knee in slight flexion, and we recommend approximately 30 degrees. It is important not to stretch the dressing upon application. The dressing should be gently molded to the skin, and be careful to smooth any creases, as this helps to ensure a watertight seal. The dressing is waterproof, and the patient may shower immediately. If you choose to use drains, they should ideally be placed away from the area so that it does not affect the seal of the adhesive border. If you are doing robotic surgery or navigation, you may use the 4-inch AQUACEL AG surgical dressing, as this protects the pin sites from potential surgical site infection. ConvaTec also offers a slim profile version of the dressing, which is designed for challenging incisions, such as larger patients undergoing total hip replacement or lumbar spine procedures. You may choose to use ice, and ice can be placed in a compressive wrap directly over the incision in the operating room. Some people may also choose to use a compressive stocking, which can also be placed directly over the dressing following the surgical procedure.